Have you ever felt that no matter how hard you try, diabetes still feels like an endless battle? You eat carefully, go for regular checkups, take your medication on time, yet there are still days when your blood sugar suddenly spikes without warning. There are still mornings when you wake up feeling drained, with numb hands and feet, a racing heart, and you do not know why. I want to tell you this, you are not alone. And perhaps you are not doing anything wrong, it is just that you have not been told about the very small things that are actually incredibly important. Did you know that, according to an analysis from the National Institutes of Health, over 70% of people with type 2 diabetes are currently deficient in at least one essential vitamin or mineral? These deficiencies silently reduce the effectiveness of insulin, making it harder for you to control your blood sugar, and increasing the risk of complications even when you are doing everything right. It may sound worrying, right? But from that very fact, there is also a ray of hope. Today, I will share with you 4 truly useful tips, all based on science, to support you in managing your blood sugar in a natural, healthy, and uncomplicated way. From an ancient herbal compound to forgotten minerals and simple daily habits that support your well-being. You do not need to change everything. You just need to understand clearly and start from the simple things. That is the true value this video aims to offer you. So, if you have ever felt confused, exhausted, or just want to find a fresh, easier, and more effective approach, please take a few minutes to watch this entire video. I believe what you are about to hear can change the way you live with diabetes. No more struggle, but instead clarity and proactive control. Have you ever heard of the name berberine? Maybe not yet. This is a compound extracted from plants such as coptes, philodendron, and several other herbs commonly used in traditional East Asian medicine. For centuries, berberine has been present in herbal remedies to treat inflammation, digestive disorders, intestinal infections, and even metabolic conditions. But what is truly surprising is that it was not until recent decades that modern medicine began to wake up and discover the real power of this compound, especially in controlling blood sugar levels in people with type 2 diabetes. A meta-analysis published by the U.S. National Library of Medicine revealed that people with type 2 diabetes who took berberine in doses ranging from 600 to 2,700 milligrams per day experienced an average reduction of up to 20% in fasting blood glucose and in their HbA1c levels, which reflect average blood sugar over a 2 to 3 month period. Even more interesting, in some clinical trials, berberine was shown to be as effective as metformin, which is currently the most widely used medication for managing type 2 diabetes. This is no small comparison because metformin has been extensively studied and is currently prescribed to millions of people around the world. The fact that a natural compound can perform on par with a pharmaceutical drug has prompted many nutritionists and endocrinologists to take another look. So how exactly does berberine work to bring about such results? The answer lies in its complex yet logical biological mechanisms. Berberine acts on multiple organs in the body in a way that very few natural herbs can. It helps improve insulin sensitivity, which means it helps insulin function more effectively by allowing glucose to enter cells more easily. For people with type 2 diabetes, this is the key issue. Insulin is still present in the body, but the cells are not responding properly, causing blood sugar to remain high. Berberine improves the communication between insulin and the cells, as if it is healing a broken dialogue. But that is not all. Berberine also helps the pancreas produce insulin more efficiently, which is crucial for people who are beginning to experience a decline in pancreatic function. In addition, this compound suppresses the production of glucose in the liver, which is often an overlooked cause of high blood sugar even when no food has been consumed. Berberine also slows down the absorption of carbohydrates in the small intestine, preventing blood sugar spikes after meals and thereby reducing the risk of blood vessel damage and cardiovascular complications. Another study published in the Journal of Clinical Endocrinology and Metabolism showed that after 3 months of using berberine, patients not only had better blood sugar control but also saw significant reductions in bad cholesterol, LDL, total blood lipids, and a slight improvement in good cholesterol, HDL. These are substantial results for people with diabetes who are at high risk for atherosclerosis and stroke. Beyond its role in supporting insulin, berberine also helps reduce systemic inflammation, which is a root cause of many diabetes complications, including nerve damage, kidney issues, vision problems, and heart conditions. When chronic inflammation is kept in check, the body begins to heal more effectively, recovery from damage improves, and patients often feel more energetic in their daily lives. As for dosage, most studies suggest that a typical daily dose ranges from 500 to 1500 milligrams, usually divided into 2 or 3 doses. The best time to take it is 15 to 30 minutes after meals, as this is when the compound can directly assist in slowing down carbohydrate absorption and regulating post-meal blood sugar responses. However, because berberine can cause mild digestive side effects such as bloating, diarrhea, or nausea in the first few days of use, beginners should start with a low dose and gradually increase as the body adjusts. One important point to note is that if you are currently taking metformin, insulin, or blood pressure medications, you should consult your doctor before using berberine. If not combined properly, berberine can enhance the effects of these medications and may cause blood sugar or blood pressure to drop too low. Additionally, pregnant or breastfeeding women, children under the age of 12, and individuals with severe liver disease should also be cautious when considering the use of this supplement. If you are looking for a berberine supplement, choose products from reputable brands that clearly state the dosage and source of their ingredients. It is best to opt for products standardized to contain 90 to 97% berberine hydrochloride, produced by trusted companies such as Thorne Research, Doctor's Best, or Integrative Therapeutics. Berberine is not a miracle drug, but in a world where diabetes is becoming increasingly common and patients often rely on long-term pharmaceutical medications, a natural solution with such promising support like berberine deserves serious consideration. It is not meant to completely replace modern medical treatments, but when used correctly, berberine can be a powerful piece in your healthcare journey, helping you manage your blood sugar in a more natural, safe, and comprehensive way. Let us be truly honest with ourselves for a moment. How long has it really been since you gave yourself a moment of true rest? And by that, I do not mean lying in bed with your head still full of worries about bills, your children, or your upcoming medical checkup. I mean a genuine moment of peace, a small window of stillness where you do not need to do anything at all. A time when you simply breathe slowly, become aware of your body, and allow your mind to settle into quiet naturally, without effort or pressure. If you are someone who lives with diabetes, then this question becomes even more important than the question of what you ate for breakfast today. Because here is a truth that many people still overlook, even though science continues to confirm it with increasing clarity. Mental stress, even when it is subtle and not easily recognized, can completely undo all of your efforts to control your blood sugar. You may already be eating in a disciplined and mindful way. You might be taking your medication on time every day. You may even wake up early each morning to exercise. But if you are constantly trapped in worry, sleep poorly at night, feel restless during the day, or struggle with managing your emotions, then your body will still fall into a state of metabolic imbalance. And one of the very first symptoms of that imbalance is that your blood sugar will begin to rise uncontrollably. Why does that happen? When you feel stress, whether it is due to something specific like being stuck in traffic, facing pressure about money, getting into a disagreement with someone in the family, or simply trying to keep up with the overwhelming pace of modern life, your body switches on a built-in survival system known as the fight or flight response. This is a deeply embedded biological mechanism that has existed since the time of our ancestors. Back then, it helped humans react to danger, such as wild animals or sudden disasters. When that stress response is triggered, the adrenal glands immediately release a set of powerful hormones, including adrenaline, cortisol, and glucagon. These hormones send urgent signals to the liver, commanding it to release large amounts of glucose into the bloodstream. This glucose provides quick energy, so the body can either escape or confront the danger. But here's the part that is no longer reasonable. In today's world, we no longer face threats like wild beasts or natural disasters every day. The modern danger comes in the form of monthly bills, nonstop phone calls, emotional news updates, or unresolved tensions in relationships. Yet your body still reacts in the exact same way. The hormones are released. Glucose floods into your bloodstream. The only difference is that you do not run. You do not physically burn off that surge of energy. You are just sitting there, dealing with life's challenges, so that extra glucose stays in your blood, unused and dangerous. It puts tremendous strain on your pancreas, your heart, and your blood vessels. Scientific research has shown how serious this effect can be. One study published in the Journal of Behavioral Medicine revealed that after just 6 months of practicing stress reduction methods like meditation, deep breathing, and mindfulness, Patients with type 2 diabetes saw their HbA1c levels drop by an average of 0.8%. That is a significant improvement comparable to the effect of certain low-dose blood sugar medications. This shows the powerful influence that your mental state can have on your physical health. Another study, this one from the journal Psychoneuroendocrinology, found that long-term stress can increase insulin resistance in the body by up to 20%. That means your body no longer responds to insulin as effectively, and as a result, blood sugar goes up even if you have not changed your diet or activity level. In simple terms, learning to relax every day is a form of treatment that is both powerful and practical. It does not cost anything. It does not come with any side effects, and yet it is often forgotten or dismissed. But here's the key. It is not enough to use relaxation as a last resort when you are already exhausted. The real secret is to turn it into a daily habit, a real part of your life. That means setting aside a small window of time each day, even if it is just 10 minutes, to turn down the volume of the outside world and turn inward. This does not require any complicated technique. You do not need to become a meditation expert or pay for expensive yoga classes. All you need is a quiet space in your home, a comfortable chair or soft cushion, and most importantly, a sincere intention to allow your body and mind to rest deeply. You can start with something very simple. Just sit still. Close your eyes. Focus gently on your breath. Inhale slowly, deeply. Hold it for a moment, then exhale calmly. Just 5 minutes of doing this each morning is enough to send a powerful message to your nervous system. Everything is all right. There is no danger. And when the nervous system accepts this message, it stops producing cortisol. The liver stops flooding the blood with sugar. The heart rate slows. The pancreas relaxes. And your whole body feels calmer, clearer, and more stable. You can also practice this same breathing technique at night before you sleep. That is because deep sleep is essential for hormone regulation, for reducing inflammation, and for restoring the health of your cells. When stress keeps you awake, sleep becomes shallow and unfulfilling. When your sleep is disrupted, your morning blood sugar often spikes. This becomes a dangerous cycle. But when you learn how to truly relax your body before bed, you can stop that harmful cycle from ever starting. Some people find comfort through soft background music, gentle nature sounds, or even through reading spiritual texts and prayer. All of these have similar effects on the nervous system. They slow your heart rate and activate your parasympathetic nervous system. This is the system in your body that promotes rest and recovery. It is the opposite of the fight or flight system that dominates during stress. The best part is that the benefits of building a relaxation habit extend far beyond blood sugar. People who practice daily relaxation often have more stable blood pressure, less chronic pain, better digestion, and a stronger immune system. For people living with diabetes, a condition that already makes them more vulnerable to complications in the nerves, heart, and kidneys, this is an incredibly valuable gift. No matter how old you are, no matter what stage of illness you may be in, the ability to create inner peace is something that still lives inside of you. And sometimes, the healing does not begin with anything dramatic or expensive. Sometimes all it takes is the willingness to sit quietly, take one long breath, and whisper gently to yourself, "I deserve to rest." And you know something beautiful? From that very moment, your body begins to heal. Sometimes in life, it is not the grand actions, but the small, quiet habits that bring about the biggest changes. For people living with diabetes, this becomes especially true when we talk about minerals. These are nutrients that your body only needs in small daily amounts. But their role in helping your body process sugar and manage insulin is absolutely crucial. Among these, 2 specific minerals are often forgotten, even though they are essential every single day. These are magnesium and chromium. Imagine your body as a finely tuned biological machine. In order for everything inside to function properly, from the steady rhythm of your heartbeat to the way your cells absorb sugar and turn it into energy, your body needs more than just insulin. It also requires helpers that support insulin in performing its job smoothly. Magnesium and chromium are exactly these quiet, faithful helpers. Let us begin with magnesium. One of the most common issues for people with diabetes is insulin resistance. This means that even when your body produces insulin after you eat, your cells may not respond properly. They become sluggish or less sensitive. As a result, sugar does not move from the blood into the cells where it is needed. Instead, it lingers in the bloodstream, leading to high blood sugar levels. What many people do not realize is that a deficiency in magnesium can make this resistance worse. Magnesium plays a direct role in how cells respond to insulin. Without enough magnesium, your cells cannot respond properly. This means insulin becomes less effective, even if you are eating a healthy diet and taking your medications on time. Over time, this subtle imbalance can lead to consistently elevated blood sugar levels, even if you are doing everything else right. There is strong research to support this. A major study published in the American Journal of Clinical Nutrition found that people with higher levels of magnesium in their blood had a 33% lower risk of developing type 2 diabetes compared to those who had low magnesium levels. In people who already had diabetes, supplementing with magnesium daily led to improved insulin sensitivity and lowered fasting blood glucose after 3 months of consistent use. But here's the real concern. Many people living with diabetes are unknowingly magnesium deficient. You may not feel any symptoms at first, yet every time your blood sugar rises, your kidneys work harder to remove the excess sugar through your urine. During that process, magnesium is also lost. Over time, this repeated loss can silently drain your body's magnesium reserves. It might only become noticeable when you begin to experience unusual fatigue, leg cramps during the night, or irregular heartbeat patterns. Now let us talk about chromium. Chromium may not be a well-known mineral, but its role in your blood sugar management is both unique and vital. Unlike proteins or vitamins that help build tissues or create energy, chromium works in a different way. It acts like a key, helping insulin unlock your cells so that sugar can enter. You might imagine insulin as the delivery person who brings sugar to the cells, but without chromium, that delivery person has no key to open the door. Even if insulin is present in your body, without chromium, it cannot do its job effectively. Your cells remain closed off, and sugar builds up in your bloodstream. This is why chromium is known as an insulin cofactor. It does not work alone, but without it, insulin's role is compromised. There is scientific evidence that supports the use of chromium supplements in diabetes care. A study published in the journal Diabetes Technology and Therapeutics demonstrated that taking chromium picolinate, which is a well-absorbed form of chromium, for just 8 weeks helped lower HbA1c levels. This measurement reflects your average blood sugar over the past 2 to 3 months. The study also showed that chromium improved insulin sensitivity, meaning that your body responded better to its own insulin. Some research even suggests that chromium may help reduce sugar cravings and belly fat, likely due to its ability to keep blood sugar levels more stable after meals. So now you may be wondering, if these minerals are so important, why do we not hear more about them, and why is it so important to make them part of your daily life? The reason is simple. Your body does not produce these minerals on its own. Magnesium and chromium must come from outside sources, either through food or dietary supplements. And unfortunately, many modern diets are lacking in these essential nutrients. If you do not eat enough fresh vegetables, beans, or seeds, or if you regularly eat processed foods, you may not be getting the minerals your body needs. As we grow older, our digestive systems also absorb minerals less efficiently. This is why older adults need to be especially mindful about getting enough magnesium and chromium each day. The good news is that building this habit does not have to be difficult. It can begin with the foods you already enjoy. Try including magnesium-rich foods in your meals such as pumpkin seeds, sunflower seeds, almonds, cooked spinach, ripe bananas, black beans, and red beans. A single bowl of boiled beans can provide almost 30% of your daily magnesium requirement. As for chromium, you can find it in foods like broccoli, eggs, whole oats, and animal liver. But if you feel that your diet might not be enough, there are safe and effective supplements available. Look for chromium picolinate or chromium polylnicotinate. These forms are easily absorbed and typically taken in doses between 200 and 400 micrograms per day. It is best to take these supplements after breakfast or lunch to help with absorption. The key to success with minerals is patience and consistency. Unlike medications that work quickly, mineral supplementation takes time. You may not notice changes right away, but after a few weeks of consistent intake, you may start to feel the difference. You might feel more energetic, experience fewer sugar cravings, sleep more soundly, and most importantly, see your blood sugar levels become more stable after meals. There is also a fascinating link between magnesium and your emotional well-being. When your body has adequate magnesium levels, it handles stress more calmly. Magnesium helps soothe your nervous system, improves the quality of your sleep, and reduces your body's reaction to stress hormones like cortisol. This can indirectly help protect your blood sugar from the harmful effects of emotional stress, which is often underestimated in chronic illness. To sum up, think of daily magnesium and chromium supplementation as a quiet act of love and care for yourself. It is not something flashy or dramatic. It is simple, like brushing your teeth or drinking a glass of water before bed. But done consistently, it becomes a powerful support for your pancreas, helping insulin work better and giving you the gentle, steady control over your blood sugar that you deserve. Have you ever noticed how two people can eat the exact same meal, but their bodies respond very differently? One person's blood sugar shoots up quickly while the other remains steady and calm for hours. You might think it is all about how much food was eaten or the type of sugar in it, but the real answer may lie in something much more subtle, yet incredibly powerful. That is dietary fiber. Dietary. For people living with diabetes, fiber is not just a part of a healthy diet. It is a key player in your long-term strategy to manage blood sugar, protect your heart, and reduce complications over time. And what is truly beautiful about fiber is that you do not need any special device or expensive medication to use it. All it takes is a quiet, consistent habit of eating enough fiber each day in the right way and with steady commitment. Fiber is the part of plant-based foods that your body cannot digest. When you eat vegetables, beans, fruits with peels, or whole grains, the fiber in them passes through your digestive system largely intact. It is not broken down in the small intestine like other nutrients. Instead, it moves down into your colon, where it begins to do something wonderful for your body. And its effects are especially important when it comes to controlling blood sugar. There are two main types of fiber: soluble fiber and insoluble fiber. Each plays a different but equally important role. Soluble fiber is found in foods like oats, lentils, apples, oranges, and carrots. When this type of fiber mixes with water in your digestive system, it forms a gel-like substance. This gel slows down the digestion of carbohydrates and sugar. That means sugar is absorbed more slowly into your bloodstream, helping to prevent sharp spikes in blood glucose levels after eating. This is essential because repeated blood sugar spikes are one of the main reasons for nerve damage, blood vessel damage, and other long-term complications in people with diabetes. On the other hand, insoluble fiber is found in foods like leafy greens, fruit peels, brown rice, and whole grain cereals. This fiber does not dissolve in water. Instead, it adds bulk to your stool and helps keep your digestive system clean and moving. It supports regular bowel movements, prevents constipation, and most importantly, it helps balance the community of good bacteria in your gut. This healthy gut environment plays a critical role in immune function and in managing chronic inflammation, both of which are key concerns for people with diabetes. There is strong evidence that fiber helps improve health outcomes. A study published in the Journal of Nutrition followed more than 2,000 people over a 5-year period. It found that those who consumed enough fiber, roughly between 25 to 30 grams per day, had better control of their blood sugar. Their HbA1c levels, which reflect average blood glucose over 3 months, were lower, and they had significantly fewer complications compared to people who ate less fiber. Another study from Harvard University found that fiber, particularly from whole grains and legumes, helped reduce the risk of cardiovascular disease by 25%. This is especially important, as heart disease remains the leading cause of death in people with diabetes. The science behind how fiber works is both fascinating and clear. When you eat a meal rich in fiber, the food moves through your intestines more slowly. The fiber creates a protective layer that separates digestive enzymes from carbohydrates. This delays the breakdown of starches into sugar, which gives your body time to respond gently without a sudden surge in insulin. The result is smoother, more stable blood sugar levels. It also means your pancreas does not have to work as hard, which helps preserve its function over time. But the benefits of fiber do not stop there. Soluble fiber especially acts as food for the beneficial bacteria in your gut. When these bacteria digest fiber, they produce special compounds called short-chain fatty acids. These acids have powerful effects throughout the body. They help reduce inflammation, improve insulin sensitivity, and strengthen the protective lining of your intestines. This lining helps prevent sugar and toxins from leaking into your blood in a chaotic way, which can worsen blood sugar control and contribute to chronic disease. What makes fiber even more helpful is how easy it is to include in your daily life. You do not need to force yourself to eat large amounts of vegetables at once. You also do not need to rely on green juices or expensive health products. All it takes is a few small, steady steps in your meals each day. For example, you can start your morning with a bowl of oatmeal cooked with chia seeds or ground flax seeds. These seeds are rich in both fiber and healthy fats. At lunchtime, try adding at least one handful of raw vegetables to your salad, such as lettuce, sprouts, or leafy greens. In the evening, you can replace white rice with a smaller portion of brown rice or a serving of stewed red beans. When you eat fruits like apples, pears, or carrots, do not peel off the skin, because that is where most of the fiber is concentrated. And remember to drink enough water, because fiber needs water to work effectively in your body. If necessary, you can also supplement your diet with soluble fiber from a natural source called psyllium husk. This fiber is extracted from the outer shell of the plantain seed, a plant used in traditional Indian medicine. Just one small spoonful mixed with water each day can help soften your stool, improve your gut health, and reduce the amount of sugar absorbed after meals. However, if you are taking medication for diabetes, it is important to take fiber at least 1 hour apart from your medicine. This prevents the fiber from interfering with how your body absorbs the drug. The most important thing is consistency. Make this a habit that you stick with each and every day, not just for your blood sugar, but for your overall well-being. People who eat more fiber tend to have lower cholesterol levels, a lower risk of stroke, better digestion, and feel full for longer. This helps naturally reduce the amount of food you eat without needing to follow strict diets or feel deprived. It is worth remembering that no medication can replace the broad and gentle benefits that fiber provides. This is a simple but powerful ingredient and a gentle reminder that health begins with the small choices we make every single day. So tomorrow, when you pick up your spoon or fork, take a moment to ask yourself this question: have I nourished my body with enough fiber today? If you have stayed with me until this part of the video, I truly believe that you are a very special person. Not everyone is willing to take the time to listen to their own body, to learn how to live in a healthier way, and to seek better things for their well-being. And I want to offer you my sincere thanks for your patience, for your care, and above all, for the love you are giving to yourself. Throughout this video, we have walked together through 4 simple but very important habits, from relaxing each day to reduce stress hormones, to supplementing with magnesium and chromium to improve insulin function. From recognizing the power of a fiber-rich meal to understanding that your body needs to be nourished with patience and knowledge, little by little you are rebuilding a strong foundation for your own health. You might not see results overnight, your blood sugar levels might not drop immediately, but every time you choose leafy greens instead of a sweet pastry, every time you take a deep breath before bedtime instead of worrying endlessly, every time you add a spoon of chia seeds to your breakfast, in those very moments, your body is already starting to heal. Your cells begin to respond to these positive signals. Your heart is being protected. Your blood vessels are less inflamed. And your mind feels a little lighter. We all know that living with diabetes is not an easy path. It requires change, discipline, and most of all, understanding yourself. But you are not alone. Here, we hope to walk this journey with you, not through unrealistic promises, but through simple, practical, and applicable knowledge that you can use every day. If today you choose just one small thing to begin with, that is already more than enough. Because real change does not come from giant leaps, but from steady and consistent steps. And sometimes, simply taking care of your breakfast, breathing deeply for 5 minutes in the morning, or sitting quietly for a moment before bed, you are already doing something miraculous for your body. I believe that you can do this. You do not need to be perfect. You only need to keep going. And I hope that starting today, you will allow yourself to slow down a little, eat a bit healthier, and love yourself a little more. Thank you for watching today's video. If you found these messages helpful, please do not forget to click the like button and subscribe to the channel so you will not miss any future content. Feel free to leave a comment below and share with me what you are going through. I am always here to listen to your health journey. I wish you continued strength, peace, and good control of your condition every day. I look forward to seeing you again in the next video.